medications within the adult endocrine system. So, antidiuretic hormones, examples are vasopressin or desmopressin. So, these are used in the treatment of diabetes insipidus. They enhance reabsorption of water into the kidneys, promoting an antidiuretic response and regulating fluid balance. So, vasopressin is often commonly used in the treatment of shock. With side effects include flushing, headache, hypertension. It's very important to monitor for signs of water intoxication, which is going to be drowsiness, shortness of breath, and headache. So your thyroid hormones. Thyroid hormones are used to replace the thyroid hormone deficit in hypothyroidism and myxedema coma. So your most common is going to be levothyroxine or Synthroid. Side effects include nausea, poor appetite, weight loss, sweating, heat intolerance, headache, palpitations. So when you're thinking about side effects, think about the symptoms of hyperthyroidism because they directly correspond. The main thing with thyroid hormone replacement is you want to take the medication at the same time each day, usually in the mornings without food. Also, it is safe to just assume that thyroid hormones should be given at least 4 hours apart from any other medications because a lot of other medications, including magnesium, simethicone, iron, carafate, all of these can decrease absorption of thyroid replacements. So thyroid hormones need to be taken at least 4 hours apart from other medications. Your antithyroid medications, so these are going to be examples are methimazole or iodine solution. These inhibit the synthesis of thyroid hormone. They're used for hyperthyroidism or Graves' disease. So side effects can include nausea, vomiting, diarrhea, alopecia, hyperpigmentation, and even iodism. So with antithyroid medications, you want to be sure to take the medication with meals to avoid any GI upset. And then you never want to abruptly stop the medication because abruptly stopping the medication can lead to a thyroid storm. Symptoms of the thyroid storm, if you remember, include fever, flushed skin, confusion, tachycardia, signs of heart failure. Also, in regards to methimazole may cause a granulocytosis or a low number of WBCs. So it's very important to educate this patient on the importance of notifying the provider if any sore throat or fever develops. So iodism. Iodism is a concern for patients taking strong iodine solutions such as Lugol solution. Its use should be limited for up to 2 weeks. It's usually used in patients with hyperthyroidism in preparation for thyroid surgery. This patient is going to have vomiting, abdominal pain, maybe a metallic or brassy taste, a rash, sore gums. So with your parathyroid medications, with hyperparathyroidism, medications are used to lower the serum calcium level. And then with hypoparathyroidism, calcium and vitamin D supplements are given. So hyperparathyroidism results in high serum calcium levels and bone demineralization. So you want to give medications to lower the calcium level. Whereas with hypoparathyroidism, this results in low serum calcium, which is going to increase neuromuscular excitability. So you're going to want to give calcium and vitamin D supplements to a patient with hypoparathyroidism. So you always want to educate the patient on the importance of maintaining an adequate amount of vitamin D because vitamin D is going to enhance the absorption of calcium. Also, when taking anti-hypercalcemic agents such as calcitonin, you want to educate the patient on the importance of avoiding foods that are high in calcium. So these would include green leafy vegetables, dairy products, soy, or shellfish. And also in regards to taking the medications, you do not take any other medications within 1 hour of taking a calcium supplement. All right, mineralocorticoids. So mineralocorticoids are steroid hormones that enhance reabsorption of sodium and chloride. They also promote the excretion of potassium and hydrogen from the renal tubules, and therefore they just help to maintain a fluid and electrolyte balance. So they are used for replacement therapy in adrenal insufficiency and Addison's disease. You want to take the medication with food or milk. Side effects can include sodium or water retention, edema, hypertension, hypokalemia, hypocalcemia, and subsequent osteoporosis and fractures. Stopping these medications abruptly could result in adrenal insufficiency. Your glucocorticoids, they are also used as a replacement in adrenal cortical insufficiency, or they're often used separate from adrenal insufficiency for their anti-inflammatory effects. Examples are going to be prednisone, triamcinolone, and betamethasone. Side effects. One side effect definitely you need to know for steroids is hyperglycemia. So you're going to use and caution when patients with diabetes, because you know that steroids will be elevating their blood sugar levels. You can see the other side effects there. You want to take this medication in the early morning with food or milk. And steroids, they're contraindicated in patients with cyanosis or frequent fungal infections. All right, so your androgens, such as testosterone. So side effects include masculine sexual characteristics, breast tenderness, priapism, menstrual irregularities. So in a patient taking androgens may cause bleeding if a patient is also taking concurrent anticoagulants, and they also may cause decreased serum glucose levels, which will reduce a patient's insulin requirements. So always kind of piece that together. The androgens will be avoided in patients with known prostate or breast cancer, just because androgens may stimulate the growth of tumors. You want to continually assess for liver dysfunction when a patient is taking androgens. And then while on androgen therapy, a woman should use a non-hormonal contraceptive. So your estrogens and progestins. So your estrogens stimulate the female reproductive tissue, whereas your progestins stimulate the uterine lining. So these are like your estrogen preparations, your estriadol. So they're used to stimulate endogenous hormones to restore hormonal balance, to suppress tumor growth or hormone-sensitive tumors, or for contraception. Contraindications. Breast cancer is huge. It's a contraindication. Endometrial hyperplasia, endometrial cancer, any history of blood clots, huge contraindication. Pregnancy, lactation, or hepatic disease. Now, side effects will include breast tenderness, you're going to have menstruation changes, maybe some GI upset, weight gain, and thromboembolism. That's why if a patient has a history of clots, estrogens are contraindicated. Also, it is contraindicated to smoke while taking the medication, so avoid smoking. So your insulin and oral anti-diabetic medications. So oral anti-diabetic agents are contraindicated in type 1 diabetes. Now, SGLT2s are allowed in the treatment of diabetes, but all other oral medications are not. Type 1 diabetes is going to be treated primarily with insulin. In regards to different medication classes, beta blockers may mask signs and symptoms of hypoglycemia. So remember that. Also remember that steroids, thiazide diuretics, thyroid medications, and oral contraceptives may cause hyperglycemia. And then a type of oral anti-diabetic agent known as a sulfonylurea, example of that is glipizide. It can cause nausea if alcohol is ingested. And then it can cause hypoglycemia if food is decreased or activity level is increased. So in current practice, there's so many good oral anti-diabetic options that sulfonylureas are not used that commonly just because of the potential for hypoglycemia. Also, in regards to orals, metformin always needs to be stopped at least 48 hours prior to any study that involves the administration of an IV contrast dye, because it'll increase the risk of contrast-induced nephropathy and lactic acidosis. So always discontinue metformin at least 48 hours prior to any procedure that includes the administration of a dye. Okay, as far as storing insulin, definitely know how to store insulin. You want to avoid exposing the insulin to any extreme temperatures, so you're not going to freeze insulin or place it in direct sunlight for it to get that intense heat. before you inject insulin, insulin should be at room temperature. And if you're going to use a vial of insulin within 1 month, it can be kept out at room temperature. However, if it's going to be greater than 1 month before you use it, you should refrigerate it. Okay, administering insulin, you need to know this for the NCLEX 100%. You will see this on there. So insulin glargine cannot be mixed with any other types of insulin. It cannot be mixed. Now, NPH insulin is a suspension, so the appearance is cloudy. However, all other insulins are solutions and they should remain clear. So NPH or long-acting insulin is your only insulin that may be cloudy. Now, it is going to require rotation and rolling of the mix before administration. You do not want to shake it vigorously, okay? And then when mixing insulins, know that you're always going to draw up your shortest acting insulin first, and your short-acting insulin can be mixed with your NPH insulin. Know this slide up and down, front and back. You will definitely see it on the NCLEX. And then you have your GLP-1s. Your GLP-1 is a non-insulin injectable for the treatment of diabetes. It's a sub-Q injection either in the thigh, abdomen, or upper arm. It may cause nausea, but the nausea should subside with continuous use as your body becomes adjusted to the medication. And then any other oral medications should be given at least 1 hour prior to the injection. So these are medications that are going to usually come in a pre-measured dose or pen, and they will require refrigeration.